Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, y'all. It's Friday for our MP week. I hope y'all have been having an amazing week. Today's deal of the day for MP week is my FMP and AGMP review book paperback option is on sale for $59.99. So check the link in the descriptions if you're looking to get one. I am doing that for the first 10 people today. All right. Question number one. A 2-year-old boy presents to the clinic with fever, irritability, and tugging his left ear for the past 24 hours. On physical exam, the child has a fever of 102, and you note erythema and bulging of the left tympanic membrane. The child is up to date on immunization and has no significant medical history. What is the most appropriate first-line treatment for this child with acute otitis media? Is it A, observe the patient without antibiotics, B, prescribe amoxicillin for 10 days, C, prescribe Augmentin for 10 days, or D, prescribe an oral steroid? Take a moment and tell me what you got, you guys. All right, y'all know I always recommend reading the stem of the question first, as the stem of the question will allow you to slow down. Reading the stem of the question will allow you to slow down to ensure you're answering what's being asked of you, right? So here, the stem of the question states, what is the most appropriate first-line treatment for a child with acute otitis media? And I always tell y'all, think of the A's, right? So the best answer here is B, amoxicillin. Remember, amoxicillin is first-line therapy. All right, question number two. You are caring for a 4-year-old child with a severe respiratory infection who requires a ventilator to support his breathing. The child's parents are requesting that their ventilator be removed as they believe the child is suffering too much. The medical team feels that the child still has a reasonable chance of recovery with ongoing support. You are part of the decision-making process. Which ethical principle is primarily being considered when the medical team suggests continuing life-saving treatment despite the parents' wishes? Is it A, autonomy, B, non-maleficence, C, beneficence, or D, justice? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, what ethical principle is primarily being considered when the medical team suggests continuing life-saving treatment despite the parents' wishes? All right, so let's think about it. Autonomy is more of like independence, making decisions for yourself. And in this case, the parents will be the autonomy type person because this child is underage. Non-maleficence, knowing to do no harm. Beneficence, doing to do good, the act of doing good, like something that's beneficial. Or D, justice is fairness, right? And so, matter of fact, you guys, if you were on my last practice question course, this is similar to what I was talking to y'all about, how things can seem like non-maleficence and beneficence, but you have to pay attention to what is actually being done. So although in this scenario, the medical team is not trying to do any type of harm to the child, but the ethical term is actually beneficence because they're actively trying to do good, trying to let the parents know that, hey, remaining on this ventilator, the child still does have a reasonable chance of recovery on it. So you're trying to do good for them. Now, in the situation where it would have been non-maleficence, would have been something stating that they were actively doing something to stop harm or to not do harm. So pay attention to what they are actively doing to see if this is an act to do something beneficial, good, beneficence, or something that they are actively focusing on not harming someone. So non-maleficence, no malice, right? And then lastly, question number 3, a 6-year-old child is diagnosed with leukemia and requires chemo as part of the treatment plan. The oncologist discusses the treatment options with the parents, explaining the potential benefits and risks. The parents are considering the information and they refuse the recommended chemotherapy, citing religious beliefs that prohibit certain medical interventions. The child is not yet capable of making an informed decision due to their age. Which ethical principle is primarily at play when the parents refuse chemotherapy for their child based on religious beliefs? Is it A, autonomy, B, beneficence, C, justice, or D, paternalism? Take a moment and tell what you got. All right, so here, STEM of the question states, which ethical principle is primarily at play when the parents refuse chemotherapy for their child based on religious beliefs? And here, the best answer is autonomy. This is the right for your independence to um, make those decisions for oneself, right? And because this child is still underage, the parents is making a decision for themselves. So A is your best answer, autonomy. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in a paperback or ebook option. And like I said, the first 10 people today can get that paperback book shipped to you for $59.99. If you are looking to do practice questions, my QBank options are linked in the bio of this channel. If you prefer to study independently, my self-paced review course is linked in the bio of this channel. And if you're looking to book any one-on-one sessions with me, as always, I say either call, text, or email, as I offer a variety of one-on-one session types, and I prefer speaking with you to gauge what you truly need to make sure you're booking the appropriate session. Okay? All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.